intervention in the development of a life of a child could help change a problematic life to be a healthy and reliable one. And that is when you know what to do as a parent. Do you know that as parents, our jobs goes beyond providing food for your child, also goes beyond providing shelter for your children? Now, what are you expected to do as a mother apart from providing food, shelter, and housing for your child? That is what we'll be talking about today on Children's Clinic. Children's Clinic today will be taking a look at learning disabilities in children. That is mounting surveillance on the development of your child. Welcome to today's edition of Children's Clinic. My name is Jumoke Adesua. I'll be right back after now. Don't go away.
Since 9-month-old babies now have better control of their hands, they use an inferior pincer grasp to hold food and other small objects. Furthermore, they can hold a cube between ventral surfaces of the thumb and index finger using a radial digital grasp. At this age, babies poke at things with their index finger and love to ring a bell. As they explore their new abilities, they discover that they can also shake, bang, throw, and drop objects. At 9 months, babies crawl and creep on their hands and knees and move forward by scooting on their bottoms. By now, they can also sit independently and may even pull to stand. At 9 months of age, a child develops the ability to uncover an object hidden under a cloth. A child also learns to associate words with meanings and can respond to his or her own name. As a baby's language skills continue to develop, he or she babbles and imitates vocalizations and says mama and dada, although this expression might not be directed specifically at their parents. Babies also understand a few words, such as no, no, and bye, bye.
Oh, look at you. Yeah, baby.
At this age, babies can wave bye-bye and may show anxiety towards strangers. They can feed themselves with their fingers and begin to drink from a cup. At 9 months, babies enjoy playing interactive games like peekaboo and pat-a-cake. And although they can sleep through the night, 9-month-old babies may awaken and cry.
Now, do you know that as parents, we need to have our children properly checked out by doctors to find out if they're developing well? It is not just about developing physically. What about the mental development of our child? Now, at what point should your child be taken to the hospitals for mental development or mental checkups? Well, you get to know all of this on the show today. Today on the show, I have a packet that will explain to us what this is all about. I also have a guest who is a child intervention specialist who will also take a look and explain to us what we need to do. As a parent, do you know what learning disabilities are? Do you know at what point you should be bothered as a parent on the disabilities or learning disabilities of your child? You get to know all of this on the show today. Thank you for being a part of the show. I'll be right back again after now. this segment on Children's Clinic, and we're talking about learning disabilities in children. And on this segment, I have Helen Obiageli Oshikoya. Thank you for being a part of the show.
Thank you for having me on your show.
Well, Helen is a child development clinician, a health developmental clinician. She is also an advanced certified autism specialist and early intervention specialist. Thank you for being a part of the show.
I'm very happy to be here.
All right. From your pedigree, it appears you are actually a child specialist who knows what components are when you're talking about child development. We're talking about learning disabilities in your child. Of course, this is a very wide topic, and as much as possible, let's try to lay the foundation. It's going to be a series, so let's try to lay the foundation today. So what exactly do we mean by learning disabilities in children?
Learning disabilities are quite wide, and it's not possible to touch every part.
Aspect.
Yeah. What you have to understand is that a learning disability is the inability to learn. So it doesn't
simply put that way.
Yes, simply put, and it doesn't only refer to a child. It can actually be to an adult. You can have an accident, or you can have a major illness that can actually make you learning disabled. But when we're talking about learning disabilities in children, we need to start from the beginning. And the beginning is, how do you achieve holistic development of your child?
Okay.
That's where we start from.
Okay, so achieving holistic development of your child. So let's talk about, how do you achieve that?
Holistic development of children starts basically from birth. And the process is that you have your antenatal, and then subsequent after your antenatal, then you have your postnatal checks. These postnatal checks not only check you, but also check your child. At the moment, we do the 6-week check. The pediatrician normally does the 6-week check, and that 6-week check will check the ears, and the eyes, and the little things that need to be checked by the pediatrician. But we need to go beyond that, which is done everywhere in the world, and it's through a process called developmental surveillance. Developmental surveillance is basically you check the physical and then the mental development of your child. Development is the mental capacity. What is your child able to do? Some people say, my child is growing well. And we say, is he developing well? And they like, is growth and development not the same? And we say, no, it's not. You see grown-up men who still behave like children. So they've developed. Right. So the process of developmental surveillance helps to make sure that the child is growing physically and mentally.
That's quite a bit strange, let me use the word, because I know that a lot of parents like I do are ignorant of having to do a mental surveillance on the child. So now, what are the processes of developmental surveillance on your child?
Basically, if you've had a cesarean section, we normally advise you to have your child developmental surveyed from about 4 weeks, just to make sure that there was no trauma, the child, cried, certain things like that, and make sure that everything that happened through the operational process, is okay. We normally ask them to come at 4 weeks. And then children who had no birth problems, they normally come at 6 weeks. Then it's graded 6 weeks, 3 months, 6 months, 9 months, 13 months, and at 18 months, we start checking for what they call...
Even before the child starts school?
Yes, we start what they call checking for learning disorder, which is autism, and that's a big learning disorder at the moment. So we actually check for autism at 18 months.
Okay.
And with that check, you're able to, with the developmental surveillance check, you're able to know if your child is at risk of having a learning disability later on.
Okay. Now let's talk about it. That's for children, preschool children.
Toddlers.
Okay, toddlers. Okay. Now let's talk about it. Children who have even started in school,
okay.
For parents who have been ignorant in the past, have not been doing this. So at what point should they now start developmental surveillance on the child?
Well, the thing about it is that because developmental surveillance is not so widespread at the moment, we're practicing it in a few hospitals like the Lagos State Teaching Hospital and one or two private hospitals like St. Nicholas and Heritage. But beyond that, the school should have an early intervention process which is called school health.
That's a big one again.
Yes.
Are schools ready for this?
Well, we have about 47 schools on our school health program. In fact, subsequent to before I went into the world of neurodevelopmental disorders, I'm actually a lawyer, and I know that our educational law actually states under the school health policy of 2007 that schools should periodically screen children physically and mentally. It's part of the educational act.
Have they been doing this? No.
They've been doing it in little buckets. So maybe a school would do the eye screening, leave it for 2 years, do the ear screening. No, it should be a total package which is done once a year, which checks children physically and mentally. Now, as a parent, and you notice that your child has some challenges in education, you need to call a school meeting. You need to ask the school and say, look, I've noticed this and this and this. What have you noticed? And how can we get my child to where my child needs to be? The problem about that is that some schools wait for parents to approach them. But what it should be is that the schools should be proactive and call attention to the parents. Some schools will say, but when we tell the parents, they don't accept what we're saying. The thing about it is that there's what they call evidence, written evidence. If you don't have evidence, it didn't happen. So you as a school need to have documentation to be able to discuss with parents. No parent is going to shut down documentation or evidence, So there always has to be that back and forth communication, especially when a child has been identified to be going on the lines of underachievement.
Okay. Now, again, for cities where parents, for example, are busy, and then they seem not to have the time to do the day-to-day monitoring of their children, I think the issue of school calling the attention and documentation also will be key here. Now, let's talk about the timing to check for developmental surveillance in your child. At what point should parents start requesting or, insisting to have developmental surveillance?
As soon as your child is born, from a month to 1 month when your child is born, because the first 1,000 days are the days of intervention.
Okay.
After 1,000 days, it becomes a little bit more difficult, and after 5-year-old, it's actually a disorder at that point.
Okay.
There's very little that can be done.
After 5 years?
Yes, because the child will be now managed. We don't want parents managing children. We want children to be intervened.
Okay.
We want a situation whereby a delay has been detected, intervention has been put into place, and the outcomes are so significant that by the time the child is 5, we can actually start looking at taking the child off the high-risk surveillance chart.
Okay. Now, what are the telltale signs a parent could notice in a child to be bothered and know that this child needs intervention?
Well, the thing about it is that for very, very young babies, we normally ask parents, neck control, make sure that the neck, has neck control. And then we also, crying, endless crying without the baby being soothed, eye contact, the baby doesn't have eye contact, sucking problems, the baby is unable to latch onto the nipple to be able to suck so that they can get in enough nutrition. As a mother, you would suspect something is wrong. Most times you go to the hospital and they say, oh, it's a false positive, your baby is fine, and you're like, oh, okay. The problem is if you feel there's something wrong, don't suppress it, right? I'm a total Christian, total 100% Christian. But I mean, don't go to your pastor at that point. You know, you really need to go and see a doctor. When you've seen a doctor, then you can go and ask the pastor to pray about it.
All right. Thank you very much. It's been nice having you on the show. Like I said, it's going to be a continuous thing. But for now, at least we've laid the foundation of knowing what developmental surveillance is in a child. Well, the program is still Children's Clinic. We're continuing on the show. Please don't go away. We'll be right back after now. Helen Obiageli Oshikoya there explaining to us what developmental surveillance is all about. Again on the show, we'll have a break again, and when we come back, we'll be taking a look on what learning disabilities are. Surveillance is defined as a flexible and continuous process that includes eliciting and attending to parents' concerns, maintaining a developmental history, making accurate and informed observations, identifying the presence of risk and protective factors, and documenting the process and findings. Your child's growth and development are kept track of through a relationship between you and your doctor. At a well-child visit, the doctor looks for developmental delays or problems and talks with you about any concerns you might have. This is called developmental monitoring or surveillance. Any problems noticed during developmental monitoring should be followed up with developmental screening. Children with special health care needs should have developmental monitoring and screening just like those without special needs. Monitoring healthy development means paying attention not only to symptoms related to child's conditions, but also to the child's physical, mental, social, and emotional well-being. Well-child visits allow doctors and nurses to have regular contact with children to keep track or monitor your child's health and development through periodic developmental screening. Developmental screening is a short test to tell if the child is learning basic skills when he or she should, or if there are delays. Developmental screening can also be done by other professionals in healthcare, community, or school settings. The doctor might ask you some questions or talk and play with the child during an examination to see how he or she plays, learns, speaks, behaves, and moves. A delay in any of these areas could be a sign of a problem. The American Academy of Pediatrics recommends that all children be screened for developmental delays and disabilities during regular well-child doctor visits at 9 months, 18 months, 24 or 30 months. Additional screening might be needed if a child is at high risk for developmental problems due to preterm birth, low birth weight, and other reasons. If your child's doctor does not routinely check your child with this type of developmental screening test, you can ask that it be done. Many children with developmental delays are not being identified as early as possible. As a result, these children must wait to get help they need to do well in social or educational settings, for example, in schools. In the United States, about 13% of children 3 to 17 years of age have a developmental or behavioral disability, such as autism, intellectual disability, also known as mental retardation, and attention deficit or hyperactive disorder. In addition, many children have delays in language or other areas that can affect school readiness. However, many children with developmental disabilities are not identified before age 10, by which time significant delays already might have occurred and opportunities for treatment might have been missed. Research shows that early intervention treatment services can greatly improve a child's development. Early intervention services help children from birth through 3 years of age learn important skills. Services include therapy to help a child talk, walk, and interact with others. So take a lead from this today and be involved in your child's development to help your child live a healthy and purposeful life. Well, this is all we're taking today on the show. I'm sure that you have learned, I have learned, and I know that developmental surveillance is very, very necessary for your child to live a healthy and purposeful life. Join me again some other time for yet another edition of this program. My name is Jumoke Adiso. Have a great week.